Could you please tell us who is Evangel Hospital and what your contributions to Hong Kong are?
Right. Evangel Hospital was started more than 60 years ago. It's by two missionaries from America. And one of the missionary is actually a family doctor. That's why when he started the hospital, the main concept is that to introduce family medicine to the public. Now, 60 years ago, this is the place in Argyle Street. This is where Evangel Hospital is now. It's a very sort of precious historical picture. It's something people are interested in. Kowloon City is only 900 meters from the Kowloon City wall city. Wow. Now, that also explains that in those days, a lot of patients are grassroots patients. They don't have much money to pay. And that's why the missionary, they started with the clinic, and then they realized that there's a great need of medical services in Hong Kong. So they applied to have a piece of land to build a hospital. And that's how Evangel Hospital started in 1965. After that, we pioneered the family medicine training in Hong Kong. And in Hong Kong, in 1977, there's a family medicine college was formed. But they partnered with Evangel Hospital to form the first training center for family doctors in Hong Kong. But I'm sure nowadays people will hear about the government is promoting that everyone should have their own family doctors and so on. And now, this is the concept we've already been pursuing for the last 30 years. And all the doctors, frontline doctors in Evangel Hospital now are all family doctors. And we treat patients and look after patients in this concept.
Okay, so can you give us an overview of the healthcare industry in Hong Kong today? And can you tell us specifically why you should put a strong emphasis on primary healthcare?
Yeah. Now, the scope of service we provide now is quite comprehensive, like all other private medical facilities in Hong Kong. But like to share with you is about the healthcare burden that we faced in Hong Kong. Now, this is the statistics from Primary Healthcare Blueprint Bureau. So the simple statistic is that in 2021, we are having 1.5 million of population above 65. And 5% are above 80. And we're talking about dependency ratio, that is that we are 6 working populations support one non-working population. But in the 15 years' time, we are facing 31% of people in Hong Kong above 65, and 11% of them are above 80. And then the dependency ratio changed from 3 to 1. So 3 working population we support 1 non-working population. Now, what does that mean? That means that when people get older, which I'm sure we have relatives, we have parents, they all have different types of ailments. They can have chronic disease, stable ones, but they do develop more and more. There will be more people developing chronic disease. Unfortunately, some will develop cancer. And if they live very long, and even if all the health physical facilities are good, can be maintained, they do have these other problems. And then because of these problems, a lot of people develop depression, anxiety, and affect their social isolation and so on. So we're facing a very huge medical problem in Hong Kong. So on one hand, you can say that, oh, that's good. If you're in a medical industry, if you're in treating people, then you have lots of patients. But unfortunately, in healthcare industry or in facing patients, we have primary, secondary, and tertiary care. Primary care are the family doctors who see the patient in the first line. Secondary are the patients who need to have specialist care where they develop certain complications of their chronic illness. And tertiary cares are those people who end up in hospital. Now, the utilization should be in these 3 levels. So more people should see primary care, secondary care, and tertiary care. But in Hong Kong, our resource allocation, either from the government and from the HA, they are very heavily top-down on this. So you can see a lot of very, very big hospitals. And in private industry, you see very large hospitals with a lot of very state-of-the-art operation theaters, very good medicine. And I'm sure today there's some state-of-the-art testing companies here as well. And the allocation is here. It's good because these people, they knew that if you have cancer, for example, you want to have the best treatment, you want to have the best care, you want to have a lot of things. But is it sustainable? Now, the only way we can be sustainable I think government nowadays realize that. Now, if the tertiary care is good, Hong Kong is very proud of it, that we have the state-of-the-art treatment and well-known surgery and operations and treatment and so on. But if we don't do this well, the primary care, we don't do prevention, early diagnosis and intervention well, we are pushing a lot of people into tertiary care. Just a reduction of 1 or 2% of people getting into tertiary care will really help the workload. Now, I'm not talking about now, I'm talking about 10, 15 years' time. So everyone have to get in the act to do something about this. So how is it related to Evangel Hospital? Because we have been doing primary care, and this has been in our DNA, in all our practice, in our assessment, all the time. So we really support the government change of their heart now to really promote family medicine and primary care.
So, but can you describe how your hospital adds value to a patient's journey by delivering the holistic and personalized care that you're talking about?
Yeah. I think primary care is mainly to do prevention, early diagnosis, and intervention. But if you look at the patient as a whole, now people are affected by a lot of things like behavior. This is what we're supposed to be doing: education, screening, prompt intervention, and so on. But nowadays, we have to change the patient's behavior. Patients have to know that they have to take a responsibility of their health, and they have to do something about it. And I'm sure a lot of people here are very health conscious anyway, but there are some who are not. If they're not, then they will affect their outcome and affect eventually their health-seeking behavior. So what we want to do is that we want to have doctors who know the patients well. We look at the patient not on just the physical aspect, not on the screening aspect or just one aspect. We look at the social, the psychological side of what affects them. Because if you know the patient well, the patient are more likely to listen to your advice, more likely to comply to your treatment. Now, there are lots of people who know what they should do, but they can't do it. So they seek even their family knows that, but they cannot do it. It's because of motivation, because of the surrounding environment, because they have too much stress. That's why they cannot bother to worry about their own health. So family doctors are important to show continuity care, to have a long-term relationship with the patient, to encourage them to do more prevention, to encourage them to take more responsibility. And the family doctor, the good thing is they tend to treat patients in the community. That's what we call ambulatory care, so that the patient would try to, but that will reduce cost ultimately, because we don't admit a patient in the hospital just for anything, just to give them a treatment, investigation. So we try to do them mostly in outpatient basis. So the patient will stay at home most of the time. So that's the unique thing about Evangel Hospital, is not just looking at the physical, social, psychological. We also look after the spiritual side of things. Because we're a Christian hospital, we started by, we want to propagate God's love and peace. So in our patients, we also show that we want to share with them if they have spiritual needs. For example, we have a whole team of chaplaincy and voluntary workers to be able to address to these needs.
Okay. Now, what can we expect from Evangel Hospital in the new year?
Yeah.
Because recently, the chief executive, in his policy address, he was talking about boosting Hong Kong's status as a health and medical innovation hub. So are you going to bring in any new med tech? What's in the pipeline?
No, I think what people are always interested in, which attracts people's eyeball, is the highest technology and so on. Now, we want to show that now there's other ways of doing it, because, for example, the IT technology, they can, in the future, we can think of providing hospital apps, or nowadays it's very popular to do teleconsultation, and also using AI to help us to assist in diagnosis and so on. So we have our own app, and then we are improving. At the moment, we are developing it and trying to improve, and we're trying to talk to different technology companies to see what else we can do to adopt new technologies, to do remote monitoring, use artificial intelligence for medical intervention. We are all adopting all these things. So these things are the things that we'll probably want to be able to adopt in the future.